everybody. Hopefully that we've got some people already on here. We'll just wait and see what's going on. My name is Chantelle Newman, and I work for Dan Europe, and we've been working with Dan for quite some time. I'm saying probably about 2010 we started to work together. And what my main focus was to be able to try and put together a diver medical technician course, so that we could actually give our divers and our team, anybody who dives, and particularly also the Dan crowd, a better understanding of advanced first aid with a little bit of invasive procedures. So what I would like to talk about today is something that's very, very close to my heart, and it is actually making sure that we can actually look after divers, and making sure that if you are with us, that you are actually going to be interested in saving people's lives as well. I have a PowerPoint presentation, and what I'm going to do is I'm actually going to leave the screen, and I'm going to use the PowerPoint presentation. And then if you have any questions in the background, then I'd like to answer them probably when we're finished with the presentation. So hopefully that will work. So just bear with me while I just sort this out. All right, first and most important of all, let's have a look here. Okay. Is there anybody that's arrived in here? If you just go into the chat section there and just let me know if you're there. Right. Hey, Leslie, are you still there? Hey guys, so good to hear you. So I just needed to know that somebody was there and I wasn't talking to nobody. Oh, fantastic. Diveline team are listening. Thank you so very much. Okay, now I feel a little bit more comfortable that I'm actually talking to some people. So great, awesome. So can you see, I'm going to now create a full screen here so we can actually do this, because you don't have to look at me. You can look at my PowerPoint presentation. So just bear with me. And there we go. Right. So let's hope that this is working. Right, so the whole PowerPoint presentation was be ready. Now I'm going to go through some of the PowerPoint presentation, and then what I'm going to do is I'm going to come back to just make sure that the PowerPoint presentation is actually, you can actually see it. So it should actually be the whole of my screen. Now I can only see the PowerPoint presentation. I can't see the questions but we will come back to that. So I'm going to do this for, like, say, the first few slides, and then just make sure that you guys can actually see the PowerPoint presentation, or if you're seeing me. So the whole thing that we wanted to do was actually go through the diver medical technician course, which was actually created in 2012. So we started working on, Dan and myself started working on this course, and it basically came from working in the ambulance service with myself, and then obviously my love of diving. And I knew that there was a course out there for commercial divers, but the thing that really concerned me was that not the concern of the commercial divers entirely. It was the fact that they had a course for an organization, the commercial divers, who were predominantly very well scrutinized. They were governed properly. They started having loads of accidents, and then like MCAR and health and safety became involved, and then obviously they were, had more of a safe environment. And the problem with recreational divers and technical divers is that sometimes we're on our own. Sometimes we're in environments that are far away, remote areas, and sometimes we're in workplaces that, not necessarily workplaces, but places where we're out of the country, for instance. So I'd say that if you're a professional diver, whatever agency, because we're agency neutral. It's important to be able to know that if you are working and you're teaching, that you're safe. But the most important thing is that we created the diver medical technician course because it was so important for particularly dive leaders to understand that they have a responsibility and that they should really know what to do in the case of emergency. Because if anybody's going to be turning to somebody, it would ideally be the people looking at the instructor or the dive master or the rescue diver being the person who knows what they're doing. So this was something that I felt that wasn't governed as much, and that there were loads of accidents that were happening. So this is an amazing plaque, or this is our logo for the diver medical technician. So when somebody ends up becoming a diver medical technician, they end up getting this logo on their clothing and all that, which we supply. So this is, whenever you see this sign, you know it's all related to Dan, and this is Dan Europe. So it's very important that you realize this is Dan Europe, not Dan America individual, and we created through Dan Europe. So the diver medical technician course was Dan Europe. All right, so what I wanted to talk about was fatalities. Now, I'm actually going to go back to the main screen because I'm quite worried that I know that I was watching Christina Zanato's and she was actually talking without a screen. So I've got to just check that I'm doing the right thing. So just bear with me. I'm just going back again. Check on you guys. Are you seeing, did you see the full presentation? Can somebody just message me and let me know, please, in the chat box? Did you see the full presentation? I'll go back to it. Anybody right? Oh, thank you. All right, so I'm going back. Thanks, Craig. You really gave me a peace of mind. Right, so let's go back here. Right, so fatalities. Now, thanks to Bezac, we were able to get some fatality reports, and this is predominantly in the UK. And because obviously that's where I predominantly work in that, and we could get a broader aspect of like Europe, Americas, and all these different things. But I just wanted to centralize just generally on fatalities within the UK. And in 2018, we saw that the average age of fatalities was 56 years old. So there was a group of people who were over 70s, and unfortunately these people passed away. But what they actually did find out that it was generally because of the aging diver. Now you'll find that predominantly if you go to the United States and those areas, and particularly you know, really exotic areas that you go diving, you find that there are a lot of people who are in their 60s, 70s who are diving because they're able to be able to get out. They haven't got that much work, and because they're retired. And so basically what they do is they go and enjoy their holiday by going and diving. So aging divers is quite a big thing. And then obviously very, very important is that with regards to the average diver being 56, this is where we're going to end up experiencing people with maybe possibly pre-existing conditions. So the causes were aging diver, falling unconscious in water, and that could have been a number of different things that it could have actually created, pre-existing medical conditions, and then we've got emergent pulmonary edema, and I've put both the American and the UK or European right in there. And then also solo dive or separated while diving. So fatalities are quite a big issue. You can see by the graph that there were a number of fatalities, obviously more in the time. So we're looking at 2018 being the blue box. And we had, in just 1 month, we ended up having 5 fatalities. So you can work out the numbers there to see how many people had actually passed away. But the most important thing is that if we could actually prevent this happening altogether, that would be a great thing. So in this case, I'm looking at avoiding fatalities, how do we do that? Well, there's so many different things, and I'm sure that you as divers yourselves would realize that making sure that you're doing your buddy checks, getting health checks, which to me is a very, very important thing. That's not to stop you from diving, it's just to make sure that you don't die when you're diving. So like pre-existing medical conditions, there's so many people out there end up having pre-existing medical conditions because they're not going to the doctor frequently and just getting tested or looked after. And we're talking more of the generation of 40 years and over. So with regards to looking after yourself and making sure that you're fit to dive, is such an essential thing so that we don't end up having people who are actually going to die because they're actually not looking after themselves. I stopped diving for, now for about a year now in order for me to be able to get myself fit and healthy to be able to go diving, because the worst thing I would want is to be able to go diving and have something happen to me and put somebody else at risk. And that's always a big thing in the back of my head. Now, the next slide is decompression incidents. So as you can see here, we have quite a few decompression incidences. This was also the blue box, which is 2018, and the average, which was between 2013 and 2017. So this is the month of occurrences of decompression incidences. So we're just letting you know that, obviously the highest point once again in July, which is our summer months, we ended up having quite a high. So we're looking at probably about 13 people who had decompression incidents. So obviously in our winter months, which is from November to February, people are not necessarily diving that much because it's very, very cold. But you can see in the actual summer months, which is anything from April to September, is that there's quite a high consideration of having these incidences with decompression incidents. So they are there. But the most important thing that I really wanted to bring this up with the decompression incidents is because you could end up having a patient who, goes diving, or a person who goes diving, and when they come out of the water, what would happen is they would display some signs and symptoms of decompression illness. Now, the only thing that we're going to end up having to do is look at them and do a neurological assessment. Now, if you don't know how to do a neurological assessment, that is quite an important thing to be able to know, because if you're not able to be able to do a neurological assessment, you're basically not going to know what's wrong with the patient. So by doing or being trained in neurological assessment, and of course Dan does the training, and it's only like a few hours during the course of the day that we actually teach you how to do this neurological assessment. It's such an integral part of training and also being in the workplace that you'll know and recognize things as they happen. So if I go back to you guys, and I just wanted to know if you could recognize what the difference of being a decompression illness and age and cage. So if I wanted to say that your diver comes out of the water, how long before you would notice, let's say, cage or age? Okay, when would that actually start showing? How many hours, minutes, or whatever? So if you can click onto the actual screen, the chat section, and let me know how long you think it takes for somebody to realize that there is a problem, and particularly how quickly would age or cage actually identify. So let's see if you guys have any idea. If you just write in the chat section, that'll be very, very helpful. So let's see who gets it. Anybody? Do I have to put you out your miseries? Yeah, Laura says minutes or immediately. Yeah, it's within 15 straight away. Yeah, it could be. So basically when somebody surfaces, within 15 minutes of them actually surfacing, it would actually show some signs and symptoms of age or cage. So arterial gas embolism or cerebral arterial gas embolism. So that is probably one of the worst bends that you can get, is cage or age, and it will actually show up within 15 minutes of surfacing. So that's the time that you have that you're concentrating on your patient or the person that comes up. You'll know that it's a really, really serious bend if by the time that they reach the surface, or otherwise 15 minutes after the dive, normally it is there and quite evident. And by the way, hello to everybody. We've got Akash, Matal, we've got Craig, Attila, Dino, Laura, Lise. Thank you so much, and Leslie, thank you so much. Really, really appreciate you all being here. Right, so go back to the slides again and make them bigger so that you can see them. And then we move on to boating and surface incidences. Now, I don't know where you are from, and I don't know where you have dived, but I want to tell you that you probably realize that there is a big incidences with regards to boating. And that is a lot of people who've had injuries and been struck by a boat, or if you have to look at the Bezac incident reports, you'll actually see that there are a tremendous amount of boating incidences that is actually quite interesting to be able to read. Now, with regards to boating and surface incidences in each month of the year, you can see that once again during the summer months that we ended up having quite a few people who ended up having these boating instances. So it's important to realize that accidents can happen anyway, okay? But particularly if you're diving, you are at risk if you have no SMB, or you have an area where there are people who just don't know the codes of boating, that there is a possibility that you end up having an injury, or your dive members or your dive buddies, they're at risk of having an injury. So that is a very, very important thing to be able to raise, is that boating and surface incidences are huge, okay? They are definitely huge out there. We'll move on to the next slide. So illnesses and injuries related to incidences. So this is basically the thing that I really wanted to talk to you about. So here we have illnesses or injuries related incidences in each month of the year, and once again higher in the summer months because that's where most people are more active, but there's quite a significant amount of people who end up having injuries or illnesses. So they range anything from choking to stomach cramps, people who have passed out because of hypoxia, IPE or IPO, which is emergent pulmonary edema, which has become more prolific than ever before because we now know what we're looking for. And if you don't know what you're looking for, this is obviously the right course to be able to take, to be able to know a lot of signs and symptoms of all different types of injuries and illnesses. Breathless during viral infections. So we've had a case where somebody had difficulty in breathing, and then they thought, oh no, that they most probably have a ruptured lung, but it wasn't. It was actually a viral infection. Now, you're not going to exactly diagnose that unless you know what you're looking for. So doctors would obviously, and diver medics and paramedics would always be looking at listening to breath sounds, but you need to know what you're listening for. Fainting, lung infection, which was misdiagnosed as indigestion. This was a doctor who had obviously been looking at a patient who came to them and said, oh no, I don't feel well. I've got this chest pain and all that. It was more of an epigastric pain. And then the doctor said, oh no, you have indigestion, take some Gaviscon and go home. And that's the case. Is no, it was a little bit more, it was a lung infection. So it depends on where you are, depends on what doctor you have. Are they able to be able to diagnose you appropriately because they have the time to check you out? Ear problems, there were a number of different people who had ear problems with barotrauma as well. Hypothermia, people who were cold. Heat exhaustion, somebody with a broken leg, because they basically jumped into shallow area of water and basically broke their leg, but then complained of pain and all that and still went on a dive, which obviously created further problems. Hit by falling rocks, people working in quarries that you end up having serious incidences with falling rocks and things like that. Muscle damage, pneumothorax, which is obviously a lung injury, a bladder infection from a P valve, and that was quite interesting, low blood oxygen levels, flooded dry suit causing difficulty in breathing, a rash, which ended up being an allergy, fractured ribs, obviously from falling, headaches and nausea. So we've obviously got a lot of these different things that happened with regards to related incidences. And as I said, you can go and read the Bezac Reports so that you can get some further information. And I could always give you that link a little bit later on. So I want you to read this, okay? And then I want you to think very, very hard because I'm going to ask you a few questions, right? So a group of friends are out for the weekend dive for a dive charter. The weather is perfect for diving. The group consists of a newly qualified skipper, one dive instructor who has qualified 15 years ago, one dive master who has been qualified for 10 years, and 4 new open water divers. 2 hours to get to the dive site. On arrival, the group gear up and jump in one at a time. They all descend to 15 meters and dive for 45 minutes. The group are instructed by the instructor to ascend slowly while he deploys the SMB for the dive boat to come and fetch the divers. During the dive, the weather has changed and there are large swells. The skipper sees the SMB and drives the boat towards the SMB. With large waves, the dive master and one other open water diver get separated from the group. There happens to be a fishing boat nearby that doesn't see the dive master and hits him with his vessel. 2 fishermen dive into the water and start screaming for help. They finally get the dive master on the board, on the dive boat, and shout for the instructor to help with first aid. The dive master has extensive propeller injuries to his head, right arm, and his right lower leg are missing. He has severe bleeding, bruising to the forehead, and his breathing is noisy. The instructor becomes pale with fear and says he has only done a basic first aid course and doesn't know what to do, as the last time he did the course, it was many years ago. Right, so the questions I want to ask you are, what is the next step in getting help? All right. Now, if you just read through, so we're going to go through what is the next step of getting help, how long until the dive master bleeds out, what would you use to stop the bleeding, what other injuries would the dive master have, and how would you know, what are his vital signs, what is the most important vital sign of giving to the rescuers, so those people who are actually coming to come and pick him up, or to whoever, like let's say for a helicopter transfer. Do you know how to treat the head injury with severe bleeding? What is happening with his breathing? Can you do anything? Would you use oxygen or not? And what other treatment can you give this patient? All right. So I'm going to go back to you guys again. And let's see what if you have any questions. Right, so once again, so we have what is the next step in getting help? Anybody know? Who are you going to call? Please don't say Ghostbusters. We know the story. Anybody writing? All right, so it's if we ask, okay, how long would it take for the dive master to bleed out? Now, bearing in mind that he's got severe propeller injuries, how long would it take for somebody to be able to bleed out? Anybody got some answers there? Okay, so there we go. So we've got Coast Guard, yeah, that would be the next help getting, yeah, absolutely. Use radio and cell to contact your local emergency contacts, fantastic. And then Arthur says bleeds out in minutes, yeah. Frank says 10 minutes, all right, go on. Craig, depends where you are, but immediate radio distress call, thank you, yeah. Would that be Mayday, 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 or Pan, Pan, Pan? Let's see if anybody could get that. So I know that there is a little bit of a delay in actually answering these questions, and I totally understand that. So let's go. Obviously, yeah, it's important to be able to get emergency help to wherever the person is. Mayday. Craig says Mayday, right? So it is an emergency thing. This guy is going to die. Okay, if you don't treat him quick enough, he's going to die. So let's have a look at the steps. So we know that we need to get help, and we need to contact somebody immediately. That's the most important thing, right? It also depends on how many people are actually at the environment that is in, that are able to be able to treat this person. And that's the very, very integral part of this whole way that we're going to make this person recover quickly, because it's important for us to be able to help promote recovery as quickly as possible. So how long until the dive master can bleed out? Well, with those significant injuries, it is quick. It's going to be very, very quick. So we're looking at somebody can actually bleed out if they haven't stopped the bleeding within 3 minutes. Okay, so that's the thing, is that we always need to think about how long is this person going to take to be able to bleed out, and it can be as quick as 3 minutes. But yeah, 10 minutes, it depends on whether the person has actually got any arterial bleeds. And how do you recognize an arterial bleed? Obviously, that's the spurting and spraying one, the bright red one, the oxygenated carrying one. So then the next thing we're looking at is, what would we use to stop the bleeding? So anybody have any ideas what you use? And I'll go ahead. So do you carry tourniquets? Okay. Do you know what a tourniquet is? And do you carry them? And do you know how to actually use a tourniquet? That's very, very important as well. Now, in doing general first aid, and I'm sure that some of the training that you've done is an important thing to be able to use. Now, Arthur says straps or belts. A belt that comes from, I mean, yeah, you can use anything that's diving related, as long as it actually does stretch. The whole idea is it to stretch. And what you want to do is make sure that it's about 2 belt, if no tourniquet. Try not to use, when we're talking about belts, if say for instance you're out of the diving industry and you're actually wearing a leather belt, don't use a leather belt, because the leather belt does not stretch. Okay, and it's very, very hard to be able to compress the area that you're actually using a tourniquet on. So it's important that if you can use an improvised tourniquet from a triangular bandage, try practice that. That's quite important. But that's something that we would be thinking about. And there's so many other things within your diving box that you may have. You've got possibly a towel, you've got clothing. If you don't have an actual tourniquet itself, which I always recommend, and I'm sorry, but it's my most favorite one because it's quite simple and it works very, very well. It's been on the market for many years, particularly in the military, is the CAT tourniquet. That's the Casualty Application Tourniquet, also known as the Combat Application Tourniquet. So that's my most favorite one. So weight belt as a tourniquet, yeah, you can. A weight belt's quite thick, but it probably would still do the job. And yes, Constantino, definitely, it is very, very important to be able to use quick clot if you do actually have it as well. So these are things that you are obviously going to end up having available for you when you do the diver medical technician course, and then you come back and you prepare your own kit, because you'll know what you'll need for these different things. So then we have some other questions here. So what other injuries could the dive master have, and how would you know? How do you think you'll be able to know that the dive master has any further injuries? And that obviously is a very, very general rule that we all know, the ABCDs, and it's very, very important for you to be able to realize that how we're going to look at this person is by doing a head-to-toe examination. But remember, we said that he has noisy breathing. So that's obviously in our ABCs. So what do we do? Does anybody know what you do if the person has noisy breathing? Can I have some answers? If anybody knows what to do with the noisy breathing. And also the other question I'm wanting to know is what is vital signs? Now, most of us do know how to do vital signs, and that's taught even with most of the DAN courses that we do. And it's important to be able to take vital signs, because that information is not kept for you to say, oh, okay, I'm only going to be the one who's going to be reading or taking these things and keeping them. You have to give them to whoever's taking over. Arthur, perfect. Clear the airway. Yeah, and that could just be genuinely maybe even doing a jaw thrust maneuver, because we don't know. I mean, if he's been hit in the head to cause an injury, there's a possibility that he's got neck injuries as well. So we have to be very, very careful how we open the airway. And we teach you how to do that because that's quite important. Right, so let's go. What is the most important vital sign of giving to the rescuers? So please, I'd love you to be able to answer this. What do you think is the most important vital sign to give to the rescuers? So any doctor out there would want to know what a certain vital sign is, because that really tells us a lot about the patient. So can you answer that question? So what is the most important vital sign? And while you're thinking about that and writing that down, the next thing we look at is, do you know how to treat a head injury and severe bleeding? That's quite important. And what are the essential things that we need to give with that? And what other vital signs we'll be looking at to be able to provide treatment? So Craig says conscious. Jason says breathing. Right, so no, because breathing is definitely, so consciousness is one of the vital signs, I'd say. Yeah, that would come under disability. Jason says breathing is very, very important. Yes, but there is one very, very important vital sign. And when you do the diver medical technician course, this is the one that we really work on, because it's so, so important to be able to tell us so much information. Arthur then says color, pulse, and respiration. They're great, yes, very, very important, but there is such an important blood, I almost gave it away, such an important vital sign that gives us so much information about what is happening with this patient. And I'm going to put you out your misery, and I'm going to tell you it's blood pressure. So I know that all the other courses that you've been taught, you've probably never been taught how to do blood pressure. And this is such an integral thing when we're actually working with patients, that we find out what the blood pressure is. So if you don't know how to take it, and I'm not talking about putting a digital monitor onto somebody and like pressing the button. No, I'm not saying about that. What I'm trying to tell you is that having a blood pressure manually being taken is such an effective way of being able to know what's happening with the blood pressure, the actual the way the heart is working, and to also tell us if there is a blood loss, because it will actually tell us loads of information. So blood pressure, and in your normal first aid courses you don't get taught that. So we really take that to a very high level of getting as much information to you about how you take the blood pressure, what you're looking for, why does it change, and things like that. So that's a very, very important thing, not only to yourself, because if you're going to be doing a diver medical technician course, there's a point that you might actually be working with a doctor, and he's going to want to know what's going on, as well as he wants to know if you're able to be able to do the next steps. Okay, so the next steps would be, if we go, okay, what other treatment can we give the patient? And diver medical technician course, you'd actually be taught how to give an IV therapy. So you would be able to put up a drip, or you'd actually help with the patient or the doctor being advised by the doctor on what to do. So Arthur says, would a boat first aid kit have a BP cuff machine in? Some do. It depends. I mean, some of the skippers, they do tend to actually have, like a full kit. I mean, if you go onto, so, oops, sorry. Right. I can hear, I don't know if you guys can hear that, but anyway, so I know that we're coming up to end of the session, but I just wanted to just quickly go through. So 5 minutes left. Thank you very, very much, Jason. So yeah, would a boat first aid kit have a BP? The question is, it depends on if they've actually put one there, but you can actually create your own kit and put it together. And if I go on to the next slide, because we're running out of time, I would just go through. Okay, so what do you learn? So this is the next step that we'll be going through. So you'll be learning responsibilities of diabetic incident, oxygen administration, CPR, vital signs, management of minor and catastrophic bleeding, poisoning, burns, and you can keep on going. There's quite a little more information there. Then you've got oxygen toxicity, anoxia, hypoxia, nitrogen narcosis, dangerous marine life injuries, treatment of common injuries, decompression, pulmonary barotrauma, dental injuries, high pressure nervous system, and the list is endless. Okay, thermal stress, hazardous drugs and intravenous fluid, setting up IVs, in-water recompression. We're looking at suturing, administration of drugs, we're catheterization. These are all the things that we are learning about. And the reason that we do actually learn about this is because we can work very closely with a doctor or even into a chamber where we can actually assist somebody who is treating a patient. So it's not for you to be able to say, okay, right, I have a license, I can do this. It's always working together with a doctor or under direction of a doctor to be able to give the necessary treatment for the patient. So to undertake the course, you need to be involved in the diving industry as a diver or surface support, know your first aid and CPR, and then obviously you must be over the age of 18, unfortunately, and because you have more of a legal age, be a recreational diver or standard or equivalent, and should be at least hold a EFR BLS first aid certification, and the certificate is over a 2-year period. Right, so please, on the DAN website, you will find all the training courses, and there is one of ours, which is the Diver Medical Technician. You've got my email address here, so feel free to be able to email me at any time. I'd love to talk to you more about the Diver Medical Technician course. It's important that we realize that there are accidents that can happen out there. Are you prepared for that? If you found a little bit uncomfortable by the questions I was asking you in the previous slide, and if you don't quite know, and I've taught you a few new things, there are so many other new things to be able to learn from the Diver Medic, and the Diver Medical Technician course. So we have prepared this especially for those people who are recreational, using all forms of breathing, and also those who don't breathe, which is the free divers. Very, very important. Obviously, you have to take a breath, but very, very important. We're there for you to be able to teach this course and to give you more information that you'll be more prepared, and you'd be confident in the treatment that you'll be giving that patient. So please, once again, feel free to be able to contact me for anything. You've got my Skype there, you've got my email address, and we'd love you to be on our next DMT course, Dan Europe Diver Medical Technician course. Thank you very, very much. Any questions? Let's just close that down there. Anybody have any questions? Great presentation. Could have done with more time. Yeah, that's not a problem. Feel free to be able to. So Craig, thank you. Yeah, I would have loved to have spoken for a lot longer, but just giving you a taster. Please feel free to be able to contact me. Love to have a chat to you guys if you're interested. So, anybody have any other questions before we leave? Are you very, very welcome, Attila? Anybody else? Thanks, Stefan. Thank you, Timon. Yeah, so we can go to the DAN booth. So I can cross over to the DAN booth, and I can answer some more questions if you have, or anything else that you'd like to chat about. So I'll be popping over within the next couple of minutes over to the DAN booth, so that we can chat there. You take care, everybody, and thank you so much for your time and your effort. Love you guys. Take care. Cheers for now.